The ED epidemic, what every man should know. Hello viewer. This is Dr. Dilip Kumar on behalf of True Power International Sexologist Clinic, Mumbai, India. We are a globally recognized holistic healing destination for comprehensive treatments, unique medicines, and the best clinical counseling services for reversing, managing and even curing all types of male and female sexual disorders. Today I will awaken you all about the symptoms and causes of erectile dysfunction. So, let's understand erectile dysfunction. Erectile dysfunction, ED, also known as impotence, is a medical condition that affects a man's ability to achieve and maintain an erection sufficient for sexual intercourse. In this video series, I will cover symptoms and causes of erectile dysfunction and the secrets of holistic healing methods for reversing, managing and even curing them earlier. My experienced team of sexologists and medical professionals work collaboratively to develop personalized treatment plans tailored to each individual's needs. I understand that every person is unique, and we take a holistic approach to address the physical, psychological, and emotional aspects of sexual health. Symptoms of erectile dysfunction. Erectile dysfunction, ED, is characterized by the consistent inability to achieve or maintain an erection sufficient for sexual intercourse. The primary symptom of ED is the difficulty in achieving or sustaining a firm and rigid erection. Here are some specific symptoms and signs associated with erectile dysfunction. Difficulty achieving erection. Individuals with ED may find it challenging to achieve an erection, even when sexually aroused. The penis may not become sufficiently firm for penetration. The penis may not become sufficiently firm for penetration. Difficulty maintaining erection. Some men with ED can initially achieve an erection, but they struggle to maintain it long enough for satisfying sexual activity. The erection may be lost before or during intercourse. Reduced erection firmness. Even when an erection is achieved, it may not be as firm or rigid as desired for sexual intercourse. This can make penetration difficult or unsatisfying. Inconsistent erections. ED can manifest as occasional or inconsistent difficulties with erections. Some days or situations may be better than others. Loss of morning erections. Morning erections, which are a normal physiological response in men, are often absent in those with ED. Reduced sexual desire. While not the primary symptom, some men with ED may also experience a decrease in sexual desire or libido. However, it's important to distinguish between desire and the physical ability to have an erection. Emotional distress and anxiety. ED can lead to psychological and emotional symptoms such as anxiety, frustration, low self-esteem, and a negative impact on overall quality of life. Relationship issues. ED can strain intimate relationships and lead to communication problems and dissatisfaction for both partners. It's essential to understand that occasional difficulty with erections is common and may not necessarily indicate a chronic issue like ED. To be diagnosed with ED, the symptoms should persist over an extended period and significantly interfere with a person's ability to engage in satisfying sexual activity. If you or someone you know is experiencing persistent symptoms of ED, it's advisable to consult a healthcare provider. ED can often be effectively treated, and discussing the issue with a healthcare professional is the first step toward finding an appropriate solution and improving one's sexual health and overall well-being. Causes of erectile dysfunction. Erectile dysfunction, ED, can have various underlying causes, and it often results from a combination of physical, psychological, and lifestyle factors. Here are some common causes of erectile dysfunction. Underlying medical conditions. Cardiovascular disease. Conditions such as atherosclerosis, narrowing of the arteries, can reduce blood flow to the penis, making it difficult to achieve and maintain an erection. Diabetes. High blood sugar levels can damage nerves and blood vessels, affecting the normal erectile response. Hypertension. High blood pressure. Uncontrolled high blood pressure can lead to ED by impairing blood flow. Neurological disorders. Conditions like multiple sclerosis, Parkinson's disease, and spinal cord injuries can disrupt nerve signals required for an erection. Hormonal imbalances, low testosterone levels can be a contributing factor, especially in older men. Peyronie's disease, scar tissue in the penis can cause curvature or bending, making erections painful or difficult. Psychological factors. Stress and anxiety, emotional stress, work-related stress, or anxiety about sexual performance can lead to psychogenic ED. Depression, mental health disorders, including depression, can reduce libido and affect sexual function. Relationship issues, problems within a relationship can create stress and emotional tension, leading to ED. Lifestyle and behavioral factors. Smoking, tobacco use can restrict blood flow and damage blood vessels, contributing to ED. Excessive alcohol consumption, heavy drinking can impair both sexual desire and the ability to maintain an erection. Sedentary lifestyle, lack of physical activity and obesity can lead to various health issues, including ED. Poor diet, a diet high in saturated fats, sugar, and processed foods can contribute to cardiovascular problems, which, in turn, can cause ED. Drug and substance abuse, the use of recreational drugs or certain medications can lead to ED as a side effect. Medications and treatments. Some medications, such as those for high blood pressure, depression, and prostate conditions, can cause drug-induced ED as a side effect. Treatments for cancer, including radiation therapy and certain surgical procedures, can affect nerves and blood vessels responsible for erections. Aging. As men age, the risk of experiencing ED increases. Aging can result in natural physiological changes, such as decreased blood flow and lower testosterone levels. Psychological trauma or past sexual abuse. Traumatic experiences or a history of sexual abuse can have a lasting impact on sexual function. Other causes. Obesity. Excess body weight can lead to hormonal imbalances and cardiovascular issues, contributing to ED. Sleep disorders. Conditions like sleep apnea can lead to fatigue and reduced libido. Infections. Certain infections, such as those affecting the urinary tract, can be linked to ED. Penile injury. Trauma to the penis or pelvic area can damage the structures involved in erections. It's important to note that ED can result from a combination of these factors, and the specific cause can vary from one individual to another. Diagnosis and treatment should be tailored to address the underlying causes, and consulting with a healthcare provider is essential to determine the most appropriate approach for managing and treating erectile dysfunction. Call to action. I, Dr. Dilip Kumar, invites you. If you or a loved one is experiencing any type of sexual dysfunction or sexual disorder like erectile dysfunction, premature ejaculation, infertility, impotence, low libido, low sex drive, low sperm count, low testosterone level, penis size issues, and all about the sexual health, please subscribe my YouTube channel, The Pleasure Path Finders, and gain your knowledge that helps you to come out from the issues described above I have mentioned. Also, I encourage you all to reach out to me at True Power International Sexologist Clinic and YouTube channel, The Pleasure Path Finders. My team of sexologists and all other experts will reply your all queries and questions you ask into comment section. Also, we are here to provide you with the care and support you need to improve your quality of sexual life. Please awaken yourself about diagnosing methods of erectile dysfunction into the next video, The Hidden Truth About Men's Health, ED Uncovered. Thank you for watching and we hope to see you soon.